how to get a job as a hospital pharmacist going from retail pharmacy. A ton of you are asking me how to get out of retail. First, you need to make sure this is what you want. There is a large learning curve. You need to understand that you're gonna have to use your clinical knowledge much more than what's generally acceptable in retail pharmacy. It's a lot more hands-on in the hospital. You are the one ordering and adjusting vancomycin and warfarin and ordering troughs and INRs. Depending on your hospital, you might have to be the one ordering and adjusting CPNs. You can adjust meds by protocol for like weight, age, and renal function. You're also doing some random things like changing orders from infusion to push by protocol or changing things from IV to oral. Providers are going to be asking you some difficult questions like what do you recommend for extravasation, or how do you manage multi-drug resistant infections with patients on dialysis or on chemo. That being said, you will have ample resources in the hospital. There's always someone to ask. For example, at my hospital, I have an ID pharmacist, some ER pharmacists, critical care pharmacists. There's always someone you can ask for help. It's going to take months before you feel comfortable. It's daunting but doable. Alright, so number one on my list, this is my biggest piece of advice: leverage a connection. If you know a pharmacist or pharmacists working where you want to work, you have a strong likelihood of getting in. Number two, you can do a residency, even if it's just a PGY1. This is incredibly difficult, but it's also incredibly rewarding. Doing a residency, you're going to be working about twice as hard and getting about a quarter of the pay. That being said, you will learn a lot relatively quickly. Do a second year if you want to specialize. Third on my list is apply for a PRN or a part-time position. This is really how hospitals vet you out. Work your way up, and when a full-time position opens up, they will likely ask you first. Number four, try to stand out. Be a preceptor at your job. Give presentations to campuses. Adjunct teach. Get your ACLS certification. ASHP offers 39 professional certificates. I'm personally looking at the pharmacogenomics one and emergency medicine down the line. Number five, work as a technician at the hospital first. This is more advice for pharmacy students, but you could also apply for a technician role as a pharmacist. I'm one for the long game to get where I need to be. Some states will also require you to get a technician license to do this. Number six, keep applying. Shoot for smaller hospitals first. If you don't get a position, ask for feedback. Work in a different environment first, like long-term care, especially managed care, and then work your way in a hospital eventually. There is a lot of stigma towards retail pharmacists within the profession. I feel like retail pharmacists are looked at like the dumb ones, which is incredibly unfortunate. Not to get on my soapbox, but this is because of what capitalism, CVS, Walgreens has done to our profession, maximizing profits and implicitly and even explicitly pushing clinical responsibilities on other providers. It also has a lot to do with laws not matching or expanding to meet our clinical capabilities.